Good day. Welcome to the Harlingen Consolidated Independent School District and Valley Baptist Health System Education Talk. I'm your host, Joe DeLeon. So some of you may or may not know, stroke is the fifth leading cause of death in the U.S. and the number one cause of long-term disability among adults. With nearly a 90% Hispanic population in our region, living with type 2 diabetes and hypertension makes people here about 6 times more likely than the average American to suffer a stroke. These statistics place our population at risk, and it's important to identify a stroke early on, how to prevent them, and what resources are available to anyone who experiences these signs and symptoms. HCISD welcomes Dr. Victoria Parada from the nationally recognized and award-winning Valley Baptist Health System, a hospital system that has been serving our community for nearly 100 years. Dr. Parada is the most respected physician in our community. She's a board-certified neurologist and the member of the Valley Baptist Neuroscience Institute in Harlingen. And the list goes on. Dr. Parada is a graduate of University of Francisco Marroquin Facility of Medicine and has been practicing for more than 23 years. Dr. Parada, welcome to Harlingen CISD and welcome to this show today. We're super excited to have you here today. And we just wanted to start off with the first question, which is, what is a stroke for some people that may not know?
Well, a stroke or a brain attack is when a person suddenly loses functioning of one part or multiple parts of the body. This happens because there's an abrupt disruption of the blood flow to one specific part or multiple parts of the brain, and that translates in that loss of function. For example, a patient may immediately lose the ability to speak or communicate or elaborate the thoughts or sudden onset weakness on one side of the body.
Okay, and if there are multiple types of strokes, what are they, and how do they impact people?
Well, typically there are two types of strokes. One, which is the most common, called acute ischemic stroke, which means that there is a clot that occludes one blood vessel or multiple blood vessels, and as a result, that particular part of the brain or multiple parts of the brain start dying immediately, and that translates in that lack of function. The second type of a stroke is an intracranial bleed or hemorrhagic stroke. That occurs when a blood vessel bursts and there's a bleed inside one part of the brain. Those strokes can manifest as abrupt onset of consciousness, severe headaches, and those strokes can lead to death within minutes or hours.
Oh, wow.
Both types are very important to be recognized immediately.
So who is more at risk for a stroke?
Well, that's a wide question. So people that are older typically will have a higher risk of a stroke. As we grow older, we tend to develop certain conditions, being the most common ones: high blood pressure, diabetes, high cholesterol, being overweight, lack of exercise, or any other medical condition that limit our ability to remain functional. Those are, in general, the people or the population that will be a higher risk of a stroke. Having said that, it's very important to note that a stroke really can happen at any age, provided that the person has the medical conditions. And for females, strokes, or for women, strokes can occur at any time during their lifespan, belonging to a very unique population that can have risk of a stroke since the beginning of menstrual period to the end of their lifespan.
And this is something that is very dangerous. And, the signs and symptoms are, tremendous.
Absolutely.
And so what are some of the things that people can do to reduce the risk of that stroke?
Well, the most important thing, you mentioned it at the beginning, is recognize the medical conditions that are the main factors to cause damage in the blood vessels and cause a stroke. In our community in general, worldwide, is high blood pressure or hypertension, followed by diabetes mellitus, problems with cholesterol, obesity or being overweight, lack of exercise, and stress, living stressful situations. All those combined can increase the risk of a stroke. The older we get, the more likely that those conditions will impact our general health, and then we'll be susceptible to have a stroke.
And so, as I said earlier, it's very important to know those symptoms that you have. And so what are some of the symptoms that one might have before having a stroke?
The most common symptoms is sudden onset, lack of one functioning, being the most common. Lack of speech, someone that suddenly starts being slurred or can communicate or cannot understand. Sudden onset weakness affecting one side of the face, arm, and leg. sudden onset inability to think correctly or maintain the balance, or sudden onset numbness affecting one side of the body.
What is the number one thing people should do if someone is having a stroke, them or themselves?
Well, considering if someone can recognize that another person is having a stroke, the most important thing that they can do is call 911 and take that person to receive immediate treatment to the closest facility that can provide life-saving treatments for a stroke.
So time is very crucial, and the time it takes to get to the phone is very important. How does time play a factor in having a stroke?
Time is of an essence. As a matter of fact, in neurology and the stroke world, we say time equals brain. For every second that passes after someone is having a stroke or lack of circulation in the brain, millions of cells are dying, and that is translating in lack of functioning that may or may not be able to recover. It is important because we have nowadays life-saving procedures, and the earlier that a patient arrived to the emergency department within minutes from the onset of symptoms, the more likely that the deployment of those life-saving treatments will be effective, and that will translate in full recovery or nearly full recovery for that person. Because like you said it very well at the beginning, strokes impact the life of a human being. Not only can cause death, but more importantly is the number one cause of disability, which takes completely away the capacity of a person to remain independent and being the being that is intended to be.
And I'm glad that you highlighted that, because how can somebody cope after they've had a stroke? What is available to them? What services are available to these people?
Well, different things are available, but perhaps if you let me go back first to the treatment. First, the most important thing is really to try to receive treatment and have the life-saving procedures such as thrombolysis or thrombectomy, or in the case of intracranial bleeds, neurosurgical procedures that can minimize the damage of the brain. But like you said it well, unfortunately, many patients do not arrive in time for these life-saving procedures. And for many patients that arrive within the proper time, the procedures work, but still they will suffer from disability. There are different things that we can do in the restorative phase of acute stroke care, starting from physical therapy, occupational therapy, speech therapy, treatment of depression or anxiety. And as they move along into the transition to reincorporate to their families or the community, there are support groups that can provide psychological services and support to the patient and the family. Because once someone sustains a stroke, this is a life-changing event, not only for the person that had the stroke, but for everyone that is directly related to the care of that person.
So let's just go and talk about some of the tools that are available to determine, almost like a survey, to determine if people are at risk for a stroke. What is there out there that people can use?
There are many tools. The American Heart Association, American Stroke Association had created multiple tools that are educational for patients and the communities to learn and identify their risk factors. Just like you worded in our community that has a high number of patients with hypertension, diabetes, cholesterol, etc. There are multiple tools, there are screening tools that physicians, schools, teachers, or anyone that have access to provide any type of public education could communicate to the public for people to recognize their independent risk factors and determine if they belong into that category, which should prompt for that person the idea to seek for medical treatment or consult with their physicians, and of course address these medical conditions and treat them accordingly. Because strokes are preventable. And as we have multiple interventions to treat it when it's happening, you are absolutely correct. The most powerful intervention that we have for a stroke is prevention. The patients that do best are the ones that do not have the stroke in the first place.
And is there any words of wisdom that you would like to impart on our viewers before we wrap up here?
Absolutely. Education. It's very important that we live a healthy lifestyle. I'm very privileged to be here with the school district because that's where education starts. I think we have an obligation to teach our children to live healthy, to exercise, to make health-conscious decisions regarding their diet, and to learn how to identify medical conditions. And if those medical conditions happen along their lifetime, then understand that it's very important to recognize that medical treatment and medications are needed to prevent the disease will take over, damage our body, and then we will live to sustain diseases such as stroke that can leave permanent damage.
Well, I just want to thank you for spending some time with us and sharing your medical expertise with us. We really appreciate that, and it's a very important subject. So thank you so much for that. To learn more about strokes and their symptoms, we invite you to visit the American Stroke Association website at www.stroke.org. Also available 24/7, please visit www.valleybaptist.net to learn more about your health and wellness, including available services at your Valley Baptist. I'm Joe DeLeon. Thank you for watching this edition of the Harlingen Consolidated Independent School District and Valley Baptist Health System Education Talk. You can watch this program on the KHGN YouTube channel, or you can also view this program and download this program on the Valley Baptist System's Facebook page. Just look for them on Facebook at Valley Baptist Medical Center. Thank you so much. We'll see you next time.